recorded in Cleveland. This is News 5 at 6.
Now at 6, a quiet neighborhood rattled.
People have lives that we have no idea.
A respected Cleveland clinic researcher arrested, accused of working for China. The FBI warning China is actively trying to steal U.S. trade secrets.
Plus, Ohio is reaching a breaking point.
It would be totally irresponsible at this point not to take action.
With a record number of COVID-19 cases putting a strain on medical resources.
There's some hospitals that are at capacity.
Tonight, why people outside of cities and suburbs could be in the most danger.
Well, good evening, and thanks for joining us for News 5 at 6. I'm Courtney Gooseman.
And I'm Rob Powers. You will notice a lot of red on the latest coronavirus risk map for Ohio. That means spread is very high in most counties, and here in Northeast Ohio, Tuscarawas County is on the brink of turning purple. That's the highest level.
It's those rural areas like Tuscarawas that have Governor Mike DeWine most concerned. News 5's John Cossack joins us now. And John, that concern has to do with strain on the hospital systems there.
Yeah, the larger hospital systems, the larger population bases have those larger hospital systems that can help absorb the workload in the event you see a spike in cases. It is a safety net, though, that rural Ohio hospitals do not have. The new color-coded coronavirus map of Ohio shows a sea of red, a color once seen only in the state's largest counties, now sprawling across almost all 88. As a result,
it's taking an enormous human toll on our healthcare workers,
especially in rural Ohio.
There's some hospitals that are at capacity when it comes to what they've allocated for COVID specific treatment. And so what they're doing is some of them are making adjustments to convert other areas of the hospital or the facility to take on more COVID.
The Ohio Hospital Association is in constant communication with its member hospitals, who are in constant communication with others in their region. Ohio is broken up into 8 of them working together should patients need to be diverted if they're reaching capacity.
We saw a lot of that activity early in the spring when there were some surges happening around the prisons and in nursing homes. We saw that type of coordination happening to make sure patients got to facilities that were able to take them.
Let's put the rural numbers, though, in perspective. This is a list ranking the counties where there is the highest rate of occurrence. Of the top 12, only one, Allen County, has a population greater than 50,000. Number 1 on the list is Putnam County, just west of Findlay. The 429 cases they've seen over a 2-week period is small compared to, say, Cuyahoga County's 4,700, but their population's a mere fraction of the size. So that's equal to 1.2% of all their residents getting COVID in just a 2-week period. That same percentage, if it was in Cuyahoga County, would equal 15,000 new cases. And again, that would be just over a 2-week period. Now, the issue isn't beds, ventilators, PPE. Those things can be produced. The issue is people, nurses and doctors that can only work so long and so hard. And though Ohio was in a position in the spring to send those healthcare workers off to other states to help them handle their workload, it's a favor that those states likely would not be able to return given what we're seeing taking place nationally. In Shaker Heights, John Cossack, News 5.
All right, thanks so much, John. And it's not just the rural areas that are seeing this spread. Across the state, Ohio reported more than 7,000 new cases today. That is another record. We also lost another 35 Ohioans, bringing the total number of deaths to more than 5,600. And states across the country are seeing similar trends, and all of this is really spelling trouble for any Thanksgiving Day plans you might have. 13 states now included on Ohio's travel advisory list, including our neighbor, Pennsylvania. People entering Ohio from the states listed on there are asked to self-quarantine for 14 days.
Now, because of the rise in cases, Mercy Hospital is temporarily suspending all visitation starting today. Maternity patients are still allowed one support person, but it has to be the same person throughout their stay. There may be exceptions for end-of-life or critical patient situations. While hospitals and most businesses are doing the best they can to keep people safe, some of the more common methods might not be effective. A new study reveals temperature checks and screening questions just aren't great at catching asymptomatic COVID spreaders. Researchers tested that theory on a group of 2,000 Marine Corps recruits. Screenings only detected 3 people with symptoms, but 51 recruits ended up testing positive. Just yesterday, Cleveland Clinic announced it will no longer use temperature checks when patients arrive.
For years, he was a respected Cleveland Clinic doctor, and now he's part of a broader FBI probe into China and U.S. secrets. 5 on Your Side Chief Investigator Ron Regan has been tracking China's efforts to recruit the spy next door in communities across the country. Ron?
Well, the FBI is investigating whether the case of a former Cleveland Clinic doctor may be part of a much larger effort by China to steal U.S. technology and research.
Downtown Cleveland, you're looking just fine.
It was Wednesday, May 13th.
50s this afternoon. Light jacket weather, lots of sunshine. This is along the lakefront.
A quiet morning in the Shaker Heights neighborhood, but not far away, inside FBI headquarters in Cleveland. Federal agents were armed with this arrest warrant.
We're opening up a brand new investigation every day across this country.
Investigations linked to China. Dr. Jin Wang, a respected Cleveland Clinic researcher, born in China, he became a U.S. citizen 15 years ago. His arrest stunned neighbors.
People have lives that we have no idea.
His attorneys declined to comment. And at his home, Dr. Wang, this is Ron Regan with News 5. Could we speak with you, please? No one answered.
Probably his life is a lot like yours and I, in many respects. He reads the news, I'm sure. He takes care of things around the house, goes and punches the clock at work.
That clock was here. Short drive to the Lerner Institute at the Cleveland Clinic.
The destination is on your left.
One of the most respected and groundbreaking research centers in the world.
The problem with Dr. Wang specifically was he omitted his ties to Chinese government programs. And that's a big problem now.
A big problem because the FBI suspects China recruits professionals with access to U.S. technology and research. Dr. Wang was working on breakthroughs in heart disease. Jeff Fortunato heads up the FBI's investigations into suspected Chinese espionage here in Northeast Ohio.
The problem was he took some of those genetic samples, took them over to China, and he was conducting research on behalf of Chinese authorities, but using the genetic material of American citizens.
The FBI is investigating whether a Chinese government effort called the 1,000 Talents Program is behind it and others across the country. Eric Smith heads up the FBI's Cleveland office.
Where these individuals are actually coming to the United States, necessarily not always students, but sometimes to go to school here, to be placed in businesses here, and then to start siphoning off technology and innovation back to China.
But we're very much interested in his case and others looking at what was done with that research once it went overseas.
According to this FBI document, Dr. Wang admitted to applying for and accepting a position with the 1,000 Talents program in 2008.
The problem is, and we see this, is the second life that these people have. And his second life involved employment by a Chinese university and research on behalf of the Chinese government.
Research here, the Huashan University of Science and Technology.
Public health and preventive medicine rank #1 in China.
The FBI says the Chinese paid Dr. Wang $3 million he never disclosed, violating federal regulations. At the same time, receiving more than $3 million from you, taxpayers. Grants that are supposed to improve your health here in the United States, not China.
It became clear that he omitted funding that he was receiving from the Chinese government.
In just the last 2 years, our investigation found at least 13 others nationwide, either charged or sentenced, involving China and theft of U.S. research and technology valued as much as $600 billion a year.
That if people think about China as a company disguised as a country bent on conducting economic espionage against the United States, that is the frame of mind that all Americans need to have.
Well, Dr. Wang was fired by the Cleveland Clinic just after he was arrested. He remains free on a $100,000 bond and awaits a grand jury review of his case. His attorneys declined to comment on this story. But, Rob, just within hours, another researcher here in Ohio pled guilty to lying about his participation in the same Chinese program.
Exactly right, Ron. Song Wo Zhang was a professor and a researcher at Ohio State University. Federal prosecutors say he was working with China to enhance the country's biomedical research while using grants funded by U.S. taxpayers. He was arrested in May trying to escape to China. As part of a plea deal, he faces up to 5 years in prison. Ohio State confirms he has been fired.
Wow. And we have some new information tonight in other news. Cleveland police have arrested a suspect in the carjacking outside of St. Ignatius High School. Police say a St. Ignatius student was getting into his vehicle yesterday afternoon when two people approached him and one pulled out a gun. And according to police, the suspects allegedly pulled the teen out of his car and then stole it. Police say they've now arrested one suspect, a minor, and recovered that stolen vehicle.
An appeals court is upholding the convictions of a Euclid couple found guilty of killing 4-year-old Anaya Garrett. Lawyers for Anaya's mother, Sierra Day, and her boyfriend, Deontay Lewis, argued the two should have had separate trials and the prosecutors didn't provide enough evidence to prove they intentionally caused Anaya's death. The court upheld all of the charges except for 2 counts of child endangering against Lewis. That doesn't affect his sentence, though. Both are serving life sentences in prison, although Lewis can apply for parole after 20 years.
Still ahead. Well, it's clear tonight. It's going to be a cold start to your Friday, and in my 7-day, we're talking lake effect snow. Coming up.
Also coming up, keeping creativity alive.
Having a space like this for them to bring the goods to was sort of their path of least resistance.
Where you can find some unique holiday gifts while supporting local artists.
Plus, how would you describe 2020? Collins Dictionary just revealed its word of the year. See if you can guess what it is, and if we can even say it before we come back from the break.